Thank you so much for joining us today for the Power of Pink's virtual event, Power Forward, Making Moves to Beat Breast Cancer. Many of you have been to our events in the past, and for some of you, today's the first time, so thanks for being a part of it and making a difference. About 9 years ago, I founded the Power of Pink in honor of my sister Jill, who's a 2-time breast cancer survivor. And over the past 9 years, we've raised nearly $1 million to help women in need beat breast cancer. Many thanks to you for being here today, for my amazingly passionate Power of Pink committee who has worked so hard to produce today's event, all of our corporate and individual sponsors. Without each and every one of you, we would not be able to do what we did today. We are grateful for the work of all of our beneficiaries who have worked tirelessly to deliver the much needed services for women to beat breast cancer. The Arlington Free Clinic, Breast Care for Washington, D.C., Mary Center, and Mercy Health Clinic. Most of the women that we serve are from low-income communities of color. They've had to bear the brunt of the pandemic more than anyone. They've lost their jobs. They're unable to pay their rent. They're unable to put food on the table. Now more than ever, they need us. It's our turn to give back. For the organizations we partner with, their mantra during this pandemic has been innovation. They've had to pivot and re-engineer and reinvent the way in which they're conducting their businesses. Keeping patients, staff, and volunteers safe in the midst of a pandemic while still attending to all of their medical needs. Instituting telemedicine practices. Supplementing many volunteers who were just afraid to go to the clinics and work with full-time or part-time employees. And most importantly, encouraging women to show up for their mammograms, to have their annual screenings.
As we all know, COVID-19 has brought so many challenges, especially for our cancer patients. One of our breast cancer patients who was in chemo started having symptoms such as fevers, headaches, body aches, cough. So we immediately arranged for her to get tested for COVID-19, and she was sadly positive. We had to stop all of her treatment so that we could focus on her recovery. Because she couldn't leave her house, we were able to get her into a food delivery program through one of our partners, Food and Friends. Our social worker was also able to refer the patient to the county so that she could get rent assistance. She recovered successfully. She was able to resume her chemos. She finished all of her treatment and she had surgery about a week ago, and now she's doing good.
Cuando a mí me diagnosticaron, yo lloré 5 minutos. Eso fue lo que yo lloré. Cuando te dicen la palabra cáncer, lo primero que piensas es, me voy a morir. Entonces, yo no quería que mis hijos creyeran que yo me iba a morir, porque yo no me quería morir. Cuando hablé con mi hijo, le dije, lo tomó de una manera madura, y me dijo, pero vas a estar bien, mamá, vas a estar bien. La persona que hizo el cambio en mi vida fue el doctor Hayashi. Desde el momento que él entró por la puerta, supe yo de que era alguien diferente. Se sentó así como y empezó. Dejó la computadora así a un lado. No se puso a escribir, no se puso a hacerme las típicas preguntas, sino que él había leído mi historial. Entonces, y empezó y me dijo, ¿cómo te sientes hoy? Yo le dije, ay, mira, yo me siento, y empecé yo con todas mis quejas. Mira, sentí que fue la persona que me escuchó, que conectó conmigo y dijo, ok, me dijo, no te preocupes, aquí estamos para ayudarte. vamos a tratar de que si tienes dolor, tu dolor sea menos, porque para eso estamos aquí. Thank you, Power of Pink.
One of the core goals at Mercy Health Clinic is to provide access to healthcare for individuals that have numerous barriers that are preventing them from accessing high quality, consistent, and affordable healthcare. In addition to the barriers, all of our patients are living with poverty, and in addition to that, many of them speak limited to no English, which makes accessing care in the community even more challenging. Not only are we trying to provide the highest quality of care, we're trying to ensure that that high quality care is comprehensive, and that includes routine screening such as mammogram.
So on behalf of our patients and future patients, we're thankful for all the support that we've gotten and everything that's been given to us in order to do our jobs, in order to provide resources and healthcare for those around us, for those in the community.
During the first 2 months after reopening from the pandemic, Breast Care for Washington, D.C. was able to provide 300 screening and diagnostic mammograms to women in the region. In addition, their Mammovan, which we helped fund last year, has been out at various sites 2 to 3 times a week, including most recently at Mercy Health Clinic.
I want to say thank you to the Power of Pink and all your supporters for everything that you do to raise money that helps Breast Care for Washington continue to provide mammograms for women, regardless if they can afford it or not. We thank you. Mwah.
ECW loves the Power of Pink. Thank you all so much for your support.
Thank you, Power of Pink, for providing diagnostics for women to get mammograms. Thank you.
Thank you for powering forward with us today, making a move to help women in our region receive the much needed breast health, education, screening, and treatment.